Hey everybody, welcome to Fayetteville Pelvic Health. I'm Lacey Kells. I'm going to talk about dry needling. I use dry needling a good bit in my clinical practice. I think that it can be a really effective tool to help with pain and help restore better muscle function. However, I am a physical therapist. I am not a dry needler. Dry needling is just a tool in my toolbox. So there are many patients who are not appropriate for dry needling or who are super scared of needles. And on those patients, there's plenty of other things that we can use. But I get a lot of questions about what exactly dry needling is, so I'm going to show you. So this is the needle that we use. It's like a fine filament needle. It's actually the same needles that are used in acupuncture. However, dry needling is not acupuncture, period. They are not the same thing, okay? We're using them for different purposes, and we're using them through different mechanisms. We're doing it very differently. We do not perform acupuncture. So I'm going to dry needle myself. I'm sort of a wuss when it comes to this. Like, I'm good getting dry needled, but when I do it to myself, it's a little bit scarier. So here's my needle, and let's say that I was assessed by a therapist and they were palpating and I had some pain in maybe my wrist or maybe my elbow, and my therapist said, gosh, right here, that's a really firm nodule in the muscle. Does that hurt? And I'd say, yeah, I don't really like that. That causes my pain. Well, if I'm a good candidate for dry needling, we're going to use the needle to release that trigger point. So we clean the area. We do use gloves. I'm not using gloves because it's my own self. And then we simply tap the needle in. Okay, that does not hurt. I'm not feeling any pain right now. I don't even know that it's in there. So then what we're going to do is we're going to take the needle in and out of that muscle. So if I had a trigger point here, it would be an uncomfortable ache, like a deep achy pain. And I'd kind of be like, that's not the most fun that I've had today, but it's totally tolerable, okay? And I would release that muscle tension, take the needle out. I would give my patient a little bit of pressure, okay, just to kind of help, and then we're done. So it's really quick. The way that it works is you insert the needle into the knot or the trigger point in the muscle. That stimulates a little local blood flow, so you're getting all of these beneficial chemicals to the area, including some opioids. So that's why it helps with pain relief, because your body does make its own natural opioids. So you're getting pain relieving cells and chemicals to that area. Blood flow helps with healing, and it also helps with muscle activation. And there's also the thought that it can help the muscle fibers kind of realign into their happy alignment, so that when you go to use your muscle, those fibers are able to work really well. So now suddenly, not only do I not have my wrist pain or my elbow pain, but I can use this muscle a lot better. And so what we often do right after we do the dry needling is move into some exercise, because really motion is lotion. And once you have that muscle working better, once you have more access to those muscle fibers, you want to use them. So we go from the table to the gym floor and we do some exercising, because that's the time to do it, is to really use the new access that you have to benefit them, to strengthen them, to help you move, to bring lubrication to the area, which is going to help with pain relief. So that's what dry needling is. It's really not as scary as you think. Again, I'm not a dry needler. I am a physical therapist who performs dry needling. So, a lot of times people are like, I just want to come in and get dry needled. And I get it, and it helps me a lot too, but usually I end up doing some other treatments, because we are first and foremost physical therapists. We just have certain tools in our toolbox, and dry needling has become very popular, and for good reason, because I really do believe that it works. But again, it's not for everybody. I don't use it on every patient. I don't use it on every treatment, even if it helps a patient. You know, there's a lot that goes into it. We're really highly trained to know if you could benefit from dry needling, if you are a good candidate. So if you have any contraindications, we are trained to know that, and it can be really helpful. So if you guys have any questions about dry needling, please let me know. But I get so many questions that I wanted to go ahead and post a video, so that if you've had dry needling and you want to share it with a friend or a loved one, you can send them this link and show them what it is that we've done. Okay. Thank you for watching, and have a great day.